Good afternoon. I'm Dr. Margaret O'Connor, and I'd like to welcome and thank everyone for joining us today for the third virtual panel in a four-part series addressing some important issues for Parkinson's care partners and their family members. If you missed the earlier panels on the role of Parkinson's care in medication management or on mental health, you can view these via the WPC website. Before I go on, I want to acknowledge what an uncertain and stressful time we are living in. We hope that you are all safe and that you're finding ways to cope with all of this uncertainty. In the context of uncertainty, life goes on. And with that comes the ups and downs of being a care partner. Throughout this series, we hope to provide you with some useful information that will not only help you, but will remind you that you're not alone in this Parkinson's journey. I also want to remind our listeners that you all come to this today from a very different place, physically, of course, but also emotionally and experientially. We have some care partners who are totally new to Parkinson's and others who have been in this role for many years. While some of the panelists may cover things you already know, remember, the next person may be hearing it for the first time. Thank you for your understanding. We feel confident that no matter where you are in this journey, you will find something valuable in the next hour. We have 817 registrants from more than 25 countries who identify as care partners, family members, people with Parkinson's, and a wide range of health professionals from doctors, nurses, social workers, rehabilitation experts, and even a pharmacist or two. Today, our panelists will be discussing cognition and Parkinson's, specifically the role of the care partner. This is a very important topic because it does require partnership. We know scientifically that couples who think of this disease as our disease, rather than your disease or my diagnosis, cope better over time. These panels are designed to give you some tips and tools with which to do that. While panelists are speaking, you'll be able to submit your questions. We will ask one question right after they speak, and the bulk of the questions will be held for the end of the panel. I'd like to welcome and thank our four panelists, starting with Jenna Iseringhausen, a nurse from the New York University Movement Disorder Center, Elaine Book, a social worker from the University of British Columbia, Hyam Kramer and Thomas Gunnoud from Boston, Massachusetts, who represent the experts here as a person with Parkinson's and a spouse living with and dealing with Parkinson's on a daily basis. I also want to thank our sponsors, in particular two sponsors who made this entire series possible. Supernus Pharmaceuticals, which has already committed to be a gold sponsor of the WPC 2022 in Barcelona, and Adamas Pharmaceuticals. We would not be here without their support. And now I'm going to turn over the discussion to Jenna Iseringhausen, who's going to discuss cognition and Parkinson's. What role does the care partner play?
Hi there, thank you very much, and welcome all to our panel today. I hope that you enjoy it. But today I'll be speaking about Parkinson's disease and cognition, and give you a little bit more information on cognition and what we really mean about that when we're discussing that topic. So Parkinson's disease, as we know, it's a neurodegenerative disease process, and this causes difficulty with movement symptoms, as we all often know of that, but also the non-motor symptoms. And when we're talking about non-motor, we mean those non-movement symptoms. And cognition is a very important part of that non-motor aspect of Parkinson's disease. Cognition, what we mean by that is the ability for someone to really be able to process and learn information, as well as problem solve, and use that information to carry out their day-to-day activities. As a care partner, it's very important to be able to educate yourself on those signs and symptoms of even mild or subtle changes to cognition, as well as then that safety and quality of life, and focusing on that as well moving forward, and to keep hopefulness as well. So some of those changes that might be seen with cognitive impairment can be, again, very subtle. They might be mild, things more concerning with executive function, as we call it. And that would involve planning, flexibility of thoughts, so really those new ways of doing things, reservation or inhibition from automatic responses, and that involves movement and also language, that retrieval of information and being able to apply that information moving forward, and multitasking. That's something that we hear quite a bit, is that multitasking becomes more challenging as well. And then we might also see a little bit of progression from there. So maybe some forgetfulness, that could be difficulty recalling names or addresses, or it could then lead to more memory difficulty as well as the disease progresses. Long-term memory oftentimes can be maintained. It's more of the short-term memory that we see that can be affected. And this can also depend on that age and disease duration as well, and the impact on memory. Some of the more severe cognitive changes we might see is, again, that memory impairment, but we might also see some disorientation, maybe a little confusion as well, and over time, possibly hallucinations. So that would involve seeing or hearing or even feeling something that's not actually there. Something to keep in mind with this is that not all individuals who have cognitive impairment will develop these phases of what we call dementia or worsened cognitive status with hallucinations. It's very dependent on the individual and their progression with the disease. Some of those associated factors that we might find are older age, greater motor severity of symptoms. So again, towards the end of the disease process, that we might see some of those other changes like confusion and hallucinations. So more of the advanced stages, and also sometimes mood changes as well with that. So worsening of depression or anxiety. As a care partner, it's very important to be an advocate and to monitor for any of these symptoms or signs. Very subtle changes could be noticed by the family and care partner, and that's why it's very crucial for them to be that go-to feature for observation. So some of those subtle changes might be level of interaction with conversation. So that might decrease. Maybe before someone was very active and would tell a lot of jokes, and you start to see that changes a little bit or decreases a little bit. This could be concern for the speed of conversation, or feeling like maybe they just can't quite keep up with that speed of people conversing at that point. Also remembering to take medication, that could be a subtle sign to monitor for. Now, to keep in mind that just because someone forgets to take medication doesn't mean that they're having cognitive changes. It could also be because of a complex medication regimen and getting busy and just forgetting to take the medication. So keeping that in mind too, but certainly something to monitor for as well. Again, that multitasking can become more difficult. Repeating questions, impairment of attention, so maybe not able to maintain that attention for quite as long as they were beforehand, and increased difficulty keeping up at work. We hear this sometimes where a person with Parkinson's might come to us and talk about how they're having a little bit more difficulty at work. And so it's very important to ask more questions about that. Is it because of the movement that's making it more difficult to keep up because of the typing or maybe using a mouse? Or is it because of the communication at work and maybe difficulty giving presentations or things that they once were in charge of doing with their positions? So really asking questions is key for that. And then also possibly seeming a little more withdrawn. We can see that at times as well. And that could be even with very mild symptoms. This can also impact a relationship. It can impact the communication. It can be more difficult at times than it was before, adapting to years of an established relationship and how previously you were able to communicate, and how then having to readapt and look at even the time required to respond. Sometimes people might need a little bit more time than they once did, or adapting to the inability to multitask and that disinhibition at times. And then also as a care partner, having that discussion of, is it time to maybe change roles a little bit with things like balancing the checkbook, or things that might just take a little bit more time and cause more stress for an individual that might notice a little bit of cognitive changes. Now, what's very important as a care partner is to look at that timeline of when those cognitive changes occurred. So did they occur quickly, meaning over the span of days or weeks, or have they happened more over a longer period, like months or years even? If they have happened more quickly, it's very important to think about some of those symptoms that could be indicative of an infection. So we look for fevers or chills, but thinking about this too, that not all people of the older population may have fever, so they may not have fever as a symptom with infection. That oftentimes it could be that confusion, or so new confusion or worsened confusion that could be the first symptom of an infection. So really trying to see if there are any issues with other symptoms like urinary changes, coughing, or symptoms of maybe the flu, perhaps. Also, did the person start any new medications? That's very important to think about, that could have maybe led to some of those changes. And also looking at mood changes and sleep patterns, which can also affect cognition too. So really, again, important to advocate as a care partner and to trust your gut, because you see the person the most that you live with, that you love, and really following your intuition as well on any subtle changes you might notice. It's very important to, again, advocate to stay mentally, socially, and physically active. So music therapy and dance and exercise have all been shown to improve cognition, mood, and even quality of life. Staying socially engaged with community clubs, speech and language pathology, and also occupational therapy can work on cognitive function, language, communication, and ability to complete those everyday activities of daily living. So really, you know, the main takeaway from this portion is that I'd like for you as a care partner and as a loved one to realize that you have to trust your gut, that observation is really key in advocating for your loved one, and thinking about the timing over which that has occurred and bringing that to the attention of the provider. That way the provider can get some more of those details and decide what interventions need to be done at that point. We're really trying to optimize quality of life and to keep everyone safe, including yourselves as well. Thank you very much.
Oh, thank you, Jenna. That's a lovely presentation. I did have one question for you immediately after your talk, and then we'll take others later on. The question is, if as a care partner, we notice signs of cognitive change in our partner, and we bring those changes up to the physician, what will the physician do about it?
So that's a great question, actually, because that comes up quite a bit, actually. And so oftentimes if the symptoms are observed and you bring it up to your care partner or to your provider, your physician, they will ask you more questions. So they will ask you those questions about the timing that you've noticed those changes occurring, if any medication changes have happened, if other signs and symptoms have gone along with that at all. So those mood changes or sleep changes as well, or the way that they interact with you. And then also digging a little bit deeper about what is that interference? Is it interfering with activities or with quality of life? And then from there, they'll be able to provide some further guidance on interventions, whether that would be those non-pharmacological interventions, or if they're concerned that maybe these changes have happened faster, talking about a workup for an infection, or if it's something where there's severely interfering quality of life, discussing medication that might be able to assist with the symptoms that go along as well.
Thank you very much. Now Elaine Book will speak about how cognition impacts the care partner, and she'll give us some tips and tricks to use when cognition is a challenge. Elaine? You are on mute, Elaine. Elaine, you're on mute.
I knew that was going to happen. Okay. Oh, there we go. So now that we've heard from Jenna, oh, my notes are just kind of bopping all over here. All right, about cognitive change and how it impacts the person with Parkinson's, I want to spend a little bit of time talking about how cognitive change impacts you, the care partner, on a variety of different levels, on a social level, on a physical level, a practical level, and an emotional level. And from talking with other care partners, I often hear how cognitive change may impact their social life. If the person with Parkinson's is unable to be left alone or can only be left alone at certain points of the day or for certain periods of time, that might really limit the care partner's opportunity to participate in hobbies or interests or see friends or travel. Similarly, if the care partner's physical well-being can also be impacted because of having perhaps less opportunities to exercise or fewer opportunities to take the time to prepare nutritious meals or even go and see a doctor for their own physical health concerns. And we certainly know that stress that's associated with the role of care partner can also exacerbate any health conditions or create some health problems for the care partner as well. Practically, as the person with Parkinson's and somebody who has some cognitive decline, they may require more help with activities of daily living like med management or personal care or perhaps meal preparation or transportation. And oftentimes this assistance really falls to the primary caregiver and again can really take up quite a bit of time in the day. Now, it's important to recognize that all of these events, the social, the physical, the practical, all of these can really have a cumulative effect emotionally, a cumulative emotional impact for you as the care partner. You know, really with responsibility from homework to housework, more solo decision-making, worries and fears about the future, anger, frustration with current challenges, even guilt about feeling frustrated or guilt about taking a break. These cognitive changes for the person with Parkinson's can certainly impact the care partner on an emotional level, especially with regards to feelings of loss and grief related to the cognitive change. And I'm going to talk a little bit more about that in a few minutes. Now, part of what I do when I work with care partners who are facing cognitive changes in people with Parkinson's is really to help them look at the daily life challenges and what can be done to make life easier for you. And so if we look at those areas of impact that I mentioned, the social, the physical, the practical, the emotional, I just want to share a few ideas, some ways to approach these challenges. Now, that list of impacts that I listed was certainly not all-inclusive, and nor is this solution list all-inclusive, but really meant to plant some seeds, some food for thought to get you thinking about considering what some solutions are and what might work for you. So to address some of those social impacts on your life as a care partner, consider tapping into an existing network of family and friends, somebody who may stay with your person with Parkinson's or check in on them while you attend book club or go see a movie or have lunch with a friend. And if that existing network of family and friends is small and needs expanding, consider doing just that. I had one care partner that I worked with who actually developed kind of a mutual support relationship with her neighbor, where she prepared a meal. The neighbor came over and had that meal with the person with Parkinson's, which allowed her to go out and visit with a friend or do something else that she wanted to do. Another care partner I worked with actually enlisted in the help of her young adult grandchild, who actually lived quite a distance away. And what they did was they set up a Zoom visit between the grandchild and the person with Parkinson's, and they watched a movie together. And that way the care partner was able to go out and do something she wanted to do with peace of mind, knowing that there was somebody who was in very live communication with the person with Parkinson's. I thought that was a very creative idea. Another option is certainly to combine activities. I've yet to meet a care partner who is not amazing at multitasking. And so if the person with Parkinson's is at a physio appointment or in an exercise class, really use those opportunities to have a conversation with a friend on the phone or meet somebody for coffee. And certainly consider the options of a paid caregiver, somebody who can come into the home while you go out and try and meet some of your social needs. Now, to attend to your needs for physical well-being, you can certainly use some of those strategies that I just talked about for meeting your needs for a social life. But I think what I really want to emphasize here is the importance of maintaining overall wellness as you continue in your role as a care partner. It really is about adopting a philosophy of self-care, one that is neither selfish nor self-indulgent, but it's really critical to your ability to continue to provide the care and the support that is needed. When I talk to care partners about meeting those practical day-to-day needs of the person with Parkinson's when cognitive change is at play, I actually find that communication is often at the root of many of those challenges. Sometimes a small change in the way we're communicating can have a significant effect. So consider some simple strategies to improve communication, like eliminating distractions like the radio or television or a background conversation, especially when you're trying to communicate something to the person with Parkinson's. Remember to keep directions as simple as possible. Ask yes or no questions. Offer only 2 choices. Try to avoid open-ended questions. Certainly use paper calendars as visual reminders. And those are just a few ideas to get you going. Related to those nuts and bolts of communication, though, is this broader idea of keeping lines of communication open around difficult topics and having the conversation about advanced care planning and all things related to that early on in the condition. Advanced care planning in advance of cognitive change can really be very valuable to the care partner and the family because it can really help guide decisions in a crisis or decisions that need to be made at an emotionally charged time. So overall, when you're looking for solutions to challenges that are impacting you, consider reaching out to your healthcare team, the OT, the PT, the speech therapist, the social worker, the nurse. Each one of them might be able to offer a pearl or two that could really make a big difference. Certainly tap into your support group or other online care partner chats because they are the ones who are walking your walk and you could really learn from each other. So now I just want to mention, and I said I was going to talk a little bit about loss and grief because I really see those as being an emotional side effect of cognitive change for both you, the care partner, and the person with Parkinson's. And sometimes these very strong emotions often go unidentified or unaddressed. And so I just want to give them a little bit of airtime. Loss and grief can really be a part of the caregiving experience from the beginning of the disease and throughout the progression as well. And it might relate to many things. It could relate to changes in the relationship between you and the person with Parkinson's, changes in shared roles and responsibilities, perhaps around expectations and plans for the future, privacy, financial security, many different ways in which you might experience some loss and grief. And that can be very different for everybody. But what are some of the ways that you can deal with some feelings of loss and grief? Well, one way is journaling. Writing about your insights and reflections can be quite an effective way to look at what's happening. And it can be very empowering, can give you some emotional distance, making things a little bit more manageable and possibly less frightening. Facing losses can often leave us feeling out of control. And so try to mitigate that or counter that by setting realistic goals with a plan that you can control that might be manageable and rewarding. Consider creating something new based on how life is now. Find ways to seek joy in your present experience. Work on letting go of how life was or how you want it to be, and focus on what you can do and what you have and what's possible. And it's really important to recognize that the person with Parkinson's is also experiencing loss and grief related to cognitive change. One care partner I know engaged in a life review activity with her husband, really looking back at his life, at his accomplishments, big and small, focusing on sources of pride and pleasure and past challenges overcome. And it was a really very powerful experience in a very unique way for them to connect together. And so in closing, I just want to say that the changes and the transitions that you and your family will face can be stressful and may require you to shift how you would normally respond at a physical, emotional, spiritual, or practical level, and to try and be open to trying different strategies, different types of support at different times. Thank you.
Thank you, Elaine, for that very thoughtful presentation. I do have a question for you, and it is from someone who said, my husband minimizes his cognitive change, and he's not open to help, but then he gets frustrated when he misplaces his keys or he loses something on the computer. How can I help him to accept help?
What a great question. And it's one that I hear often. And I think, again, going back to that, the concept of open communication is a really important place to start. So you might kind of try to have a conversation about what it is that's been frustrating him. So let's say it's around the keys. So you might look for evidence of that. So you might think about examples of the time that you found the keys in this place and in this place and in this place. So have some concrete examples, and then bring it up and come up with some solutions that might work. Perhaps a note on the door in terms of where to put the keys, or a particular place that is going to be agreed upon. And pick one and start with that. And really start slow and try it for a week and then reassess. And really put in that plan that whole idea of we're going to revisit this in a week and see how it's working. The other thing too is you can suggest to him that this whole cognitive change stuff is really hard on you, and his willingness to try something is really something that he can do to help you. I think, again, just really remembering that the frustration and reluctance to have help might be tied to some loss and grief that he might be experiencing. So again, communicate about that, acknowledge with him that he might be experiencing some feelings, some pretty strong feelings around the cognitive change as well, and try and work through it rather than avoid it. I think one of the most important roles that care partners have is this idea of maintaining and cultivating hope for both you and for the person with Parkinson's. Hope can really help make the present more bearable. If we believe that tomorrow might be better, then it sometimes is easier to get through today.
Thank you again. I now want to invite Hyam, Kramer, and Thomas Gunnoud, who will talk about their personal relationship, their story, and how they've managed aspects of cognition and Parkinson's in their relationship. Welcome, Thomas and Hyam.
Sure. Well, I'm Hyam Kramer. I'm the person with Parkinson's. And this is my husband, Tom, my caretaker. We've been together for 25 years. We married a few years ago. My mother had Parkinson's. I have been genetically diagnosed with hereditary Parkinson's. And I was diagnosed about 4.5 years ago. I am very much a lucky man to be married to this guy.
Yes, he is.
So maybe you can talk a little bit, Tom.
Well, I think the important thing for me, once he was diagnosed, is to realize that his care team is not only his care team, it's my care team too. It's important for me, and has been important for me, to listen to what they see going on with Hyam. I remember his mom fondly. She was a beautiful lady. But it scares me too, because I saw her progress with Parkinson's, and she had a very difficult number of years. So for me, I'm always constantly listening to the caretaker, to the providers, to see what may in fact be coming up. Where do they see Hyam's illness right now? He is progressing very slowly. So that's a blessing right now. It has not impacted his work life. It's impacted our personal life a little bit. Hyam's able to stay very focused on his job. But when he comes home, he's spent on weekends. He has difficulty staying focused on personal goals that we have together around our apartment. Unless we're planning a trip, he's always ready to jump on a plane or a ship and go with me someplace. But that's been in this early stage. That's been the biggest thing, is difficulty in staying focused on long-term goals in his free time. Work is fine, but he's just spent on weekends, as I said before.
Well, I want to add that what is truly a gift for me is the many outlets one has for crusading against Parkinson's, for making a contribution. Professionally, I'm a fundraiser, and for political and charitable causes. And so I'm very drawn to the opportunities that are out there to participate in research, to engage in group exercise classes with other Parkinson's patients, to help, like I am here, I guess, participate in this type of opportunity to communicate and share. And I would say that to anyone who has Parkinson's, engaging in that type of activity and sharing that opportunity with your caretaker is a very rewarding experience. I would also say that, to echo Tom, it was difficult to watch my mom decline to the point where, she had lost all cognition. She did not recognize me. She had to be fed through her stomach. She declined gradually, but it was a catastrophe for me when I was diagnosed, because I immediately visualized the end stage for my mom as something that's going to happen to me. And so what's been helpful is just being more focused on enjoying and making use of what I can do, not focusing on what I can't do, but what I can do. To sort of seize the day, to embrace what's possible, and then work as a team with my husband on planning for the future, because part of my happiness is knowing that, you know, I have the support of someone who can think ahead and can engage me in that process of planning ahead, which brings me security in the here and now.
And I think as a caretaker, I find it difficult to use that term because it's not been a lot of heavy lifting, but it is emotional. It does impact you when you see your partner, your husband, your wife going through these things. It's been important for me to read my own feelings and try to understand what I'm dealing with. I liked Elaine talking about loss. We all experience losses in our life, but sometimes in a disease like Parkinson's, you can actually see them and list them as they start to happen or have happened. For me, the most positive thing has been to stay engaged in life with our family and friends and to make sure Hyam is with me in those things. We have a very supportive group of people. In this pandemic, it's been things like just having picnics or drinks out in a park where we can socially distance but be engaged with other people. They're very good at engaging Hyam in political talk, which is a passion of his. For me, I back off. But it's staying engaged in life with our family and friends and keep pushing him to do it, because he walks out of those situations just feeling so much better because he knows he's cared for and loved by the people that are important to us. And it's important to me. We need support groups beyond ourselves. The other thing I feel blessed about is living in Boston. There are so many resources here, not just for Hyam, but for myself as well. I haven't really engaged many of them at this stage, but I know there's support groups in the area that at a time when I'm feeling overwhelmed, I may need to be engaged with. I know the resources that are available to us in terms of having people from the outside come into our home and address some needs that we, in fact, together may not be able to do. Those are all just pluses and home runs in my mind.
Yeah, and the only thing I want to add is that Tom has encouraged me to participate in activity where I feel like I'm helping someone else. The wellness program that Beth Israel Deaconess Hospital Medical Center sponsors, group exercise classes with other PD patients, has provided me an opportunity to befriend other people going through PD at different stages of PD, and just to be there to listen and to counsel and to empathize and to bring friendship. I've felt a great sense of fulfillment playing a role of helping others in that regard. I've been asked to speak on some panels. I've been asked to, write and share my experiences with others. I've been in a book. Whatever I can do to help others in and of itself is rewarding, and sort of makes me feel like which I am, in the driver's seat sometimes. I'm there providing help. I'm there providing opportunity for others and hope. To echo that term, hope. It's so rewarding to bring hope to others, myself.
Yeah, one of my lines is, well, it's important to be realistic and to pay attention to what's going on. It's also important to be optimistic too, and to find those signs of hope that we can continue to live a fulfilling life together, still enjoy each other's company, and move into the future, not knowing for either one of us, for all practical purposes, what the future has in store, but just make the most of what we have day to day.
So that's our story.
That's a great story. And thank you for sharing it. You've underscored for the rest of us the importance of transparency, honesty, using the village around us for support, looking for purpose in our lives, all of those things. So a lot to take away from what you've shared with us today. Thank you very much. I did want to ask an immediate question of the two of you. Actually, it's of Tom. Then I'm going to open for the panel for questions that have been coming in. We have a lot of questions to get to. So Tom, as a care partner, what do you feel is the most important role that you can play with Hyam?
Cheerleader. That you just keep rooting him on. That,
Okay.
what can you do? And being realistic on it, but pushing him too, because sometimes Hyam has a sense of just wanting to sit back and pushing him forward to, yeah, we can do this, we can do that. We don't have to stop. Right now, your physical limitations are not the problem, but it may be your energy level. And so keeping him going, I think, is the best thing.
Okay. All right. I'd like to invite the whole panel back. And I'm going to start with questions that I'm reading in order of how they came in. The first is from a care partner in Nova Scotia, Canada. And her husband saw a neuropsychologist who attempted to distinguish between dementia and mild cognitive impairment. And her husband was tested for Lewy body dementia because she had noted cognitive issues, but the test came back normal, which was confusing. And to the extent that she thought maybe they had the wrong patient file. And the neuropsychologist said, thank you very much. We'll see you in a year. Her question is, how do neuropsychologists distinguish between dementia and mild cognitive impairment? And she was the one who came out of the appointment feeling kind of confused. So I'm going to ask Jenna or Elaine or anyone who would like to answer that question. Jenna, you're on mute.
Sorry about that. So that sounds like a very complex situation that you had there, and I'm so sorry that you felt like you left without having some of your questions answered. And so you're absolutely in the right to be asking more questions and to be trying to advocate for the changes that you've noticed. So I do appreciate you bringing that up. Now, for neuropsychological testing, there's usually a battery of tests that they will perform that will look at different like visual spatial reasoning. They'll look at executive functioning. They'll have them do different questionnaires and diagrams. I think sometimes the challenge of those tests is that they're usually very long and people can become very tired when they're taking them as well. And so, you know, oftentimes with that type of testing, there's no harm in getting another opinion or having it done, always considering, you know, the timing of when the testing was done. Was it something where maybe always with medication, to think about that with Parkinson's medication, sometimes people might notice some increased cognitive slowness or challenges when they're feeling more off from their medication. And so that can impact the results that come back as well from neuropsychological testing. So trying to observe when you're noticing those changes with your partner as well can be beneficial, and to bring that up with the provider. I'm not sure if that answers the full question, but I think that there are a number of different factors that play a role, and it's still something that's being evaluated and established quite a bit on that mild cognitive impairment for Parkinson's versus dementia versus Lewy body. And it's something that's very challenging to evaluate as well, because there's a lot of blurred lines there too with really what those differences are. Mild cognitive impairment generally is a little less severe than symptoms of Lewy body dementia or Parkinson's disease dementia per se. And so all of that comes into account as well with that testing.
Thanks, Jenna. I also wanted to follow up with you, a question from a care partner from the United Kingdom who asks about attention, focus, and lack of concentration. Are these common complaints? And are there treatments?
So these are common complaints and can happen at different stages depending on the individual, but that lack of focus and lack of attention, difficulty multitasking, we hear that very commonly and oftentimes more so from the care partners or from their loved ones, that they've noticed that about their significant other or their parent perhaps. Now, the interventions for those symptoms, generally, it depends on how much they're interfering with the day-to-day and with activities of everyday living and quality of life. If it's something where there are more subtle changes, then generally incorporating things like speech and language pathology and occupational therapy are very helpful because they can work with some of that executive functioning as well and teach different tricks and different skills and work with those specific concerns for that individual. So those are very helpful. Also, the exercise and getting involved socially can be beneficial for those symptoms too.
Thank you. So a couple questions for Elaine, Tom, and Hyam. The first comes from British Columbia, from a care partner who says, what if your partner with Parkinson's denies cognitive changes? What then?
Yeah, and again, we have to look at sometimes why that is. And again, it could be attached to their own just difficulty dealing with the changes themselves. So sometimes it's about a heart-to-heart conversation about what's going on for that person with Parkinson's. And again, it kind of goes back to that initial theme that I had talked about in terms of how do you communicate with them about those changes. Now, sometimes I say to care partners, look at what it is that you're raising. Is the way that the cognitive change is impacting his or her life, is it dangerous? Is there a safety concern here? Because if there isn't, if it means that, it takes a little bit longer to get through the newspaper, or that they're kind of innocuous types of ways in which it's impacting life, then I kind of sometimes say, pick and choose your battles. We don't have to bring up every deficit to their awareness. That's not necessarily going to be helpful. But if the deficits are showing up in areas that are going to put him at risk or put you, the caregiver, at risk, then that's when some changes need to be made. Certainly you can enlist again the support of your team or your family. Sometimes there's somebody that is able to have those kinds of conversations more easily. It may even be somebody within the religious realm that they've got a particularly close relationship with. So kind of just look at some different alternatives and options for raising the conversation. And again, having some concrete examples of why you're concerned can be really helpful.
Okay, thank you.
I like the fact, Elaine, that you said talk to the care team. Because when you're in conversation with one another, we can get frustrated if the other person's not hearing what you're saying. But when you bring another person into the conversation, that person helps you to go through the weeds and try to figure out really what's important and what's not important. But when it's just the two of us talking, sometimes, and for him too, not just me, but there's frustration. And I think that's where a third person is always helpful.
Yeah. Thank you. You speak from experience. We can hear that. And thank you for that. So a question again for the three of you, because it's about the impact of cognition on relationships. It's from a care partner from Alberta, Canada, who's having difficulty communicating with her husband, having interesting and intellectual conversations, partly because he mumbles and partly because she has to ask him to repeat things, and again, because of defensiveness about acknowledging cognitive problems. And the conversations often turn into arguments. And as a result, she's cut back from talking with him. She doesn't know how to make small talk, and wants to know whether any of you have suggestions how to handle this.
Shall I go first, Tom?
So that has not been my experience with Hyam at this particular point. It was with his mom. And it was really difficult.
I think my first comment is really to meet the person where they're at. And if you are recognizing that there is some change and that the depth of the conversation or the speed of the conversation or the content needs to change because of cognitive change, then I think you need to look at that and meet the person where they're at. Doesn't mean you stop having conversations about things that you're both passionate about, but you might change up the way that conversation looks. The other thing is to be very mindful of time of day, because the person with Parkinson's might have some times where they are really got it going on, really sharp, and other times of day where they're tired, they're fatigued, end of day, might be stressed about something else that's gone on. So really look at time of day for when you want to engage in these types of conversations, but really when you want to talk about anything important is really be mindful of the other Parkinson's symptoms, medications kicking in, that sort of thing. So timing is really important. And getting just, again, like I said, kind of creative about continuing to do the things that connect the two of you, that you enjoy doing, but that they just might need to have a slight accommodation made on it.
Okay. So speaking of mindfulness, the next question is for you, Elaine, directed to you from a person with Parkinson's disease in Indiana, wondering whether you incorporate mindfulness-based stress reduction in your clinical work. And if so, has that been helpful?
So I personally am not trained in mindfulness-based stress reduction, but I am an advocate. I recommend it frequently and recommend apps to people, both care partners and people with Parkinson's, and can absolutely attest from speaking from my clinical practice of working with people who employ it, that it can be extremely beneficial to their well-being, their overall well-being, their intellectual well-being, their emotional well-being, and to their relationships. So by all means, I think it's an excellent intervention, an excellent strategy.
Okay. And now here's a question for the entire panel. It's from a person with Parkinson's in Denver. And it references confusion that this man has had at times when watching television. For instance, he watched the US Open tennis men's final match yesterday, and he found it hard to distinguish between whether he was in the match himself, whether was one of the two tennis players, and had complete with, as he puts it, involuntary body movements and emotions. And his wife kept telling him that he wasn't actually part of the story. He was just a spectator watching other people play. On one level, he knew that was the case, but his body didn't always remember. So he wondered whether there were tips that anyone, Jenna or others in the panel, have for allowing his wife to remind him about differences between the story he's watching on television and the story that actually includes his participation.
Well, I think, one main tip, which Elaine has touched on as well, is just being patient and also being flexible and being open to getting that feedback, because I think at times there can be that defensiveness that sometimes people might feel if they're reminded of things like that, or if you're feeling like you're in the tennis match and you're not really in the tennis match. Maybe initially, if a loved one were to tell you that you're not, an immediate reaction might be frustration or maybe embarrassment. Sometimes people might feel, but taking a moment and taking a breath and remembering that you're a team and working through it together oftentimes is what helps people that I've heard have that challenge as well. Okay. Elaine, do you have anything you'd like to add to that?
Well, and again, I think it goes back to, was participating in the tennis match dangerous in any way? But, if he was engaging in all of these activities, maybe there was a chance that he was going to fall or injure himself. So just kind of looking at whether or not there's any risk associated to whatever it is that, almost like a hallucination that the person was experiencing. And if not, I often hear from people, the person with Parkinson's will say, I see the cat walking across the living room. I know that we don't have a cat. But the care partner is not going to continually say to the person with Parkinson's, "Oh, but Harry, we don't have a cat." You don't need to engage in that kind of confrontation, because having the cat walk across the living room when Harry knows that there's no cat there is okay to see. So there are some things that I think are safe to let go and experience, and we know it's going to pass, and then other things that you need to obviously take action on.
That's a great point.
Right,
And
we have a lot of questions, and I'm going to remind the audience, which I don't think I said at the beginning, but we may run over. Our panelists have all very graciously offered to hang online with us. I have a couple questions for Tom and Hyam, and one of them has to do with something you already referenced, which is COVID. How has the pandemic sort of affected the nature, quality of your interaction, the care giving part of Parkinson's? And in conjunction with that is a specific question for Tom. Do you have power of attorney for Hyam? And if so, what were the criteria that you used to put that together, to decide to move forward with that?
Well, I'll answer that question first.
Okay.
We saw an attorney probably about 4 years ago, and did estate planning. And power of attorney was part of that, as well as end-of-life decision-making and so forth. So we did it as part of a complete process for end-of-life. In terms of, what was I going to say?
So the COVID question was the second part of it.
I think the issues are the same for everybody. Isolation is just dangerous for everybody, and whether you have Parkinson's or not. And I think for me, encouraging Hyam to join me with our friends in whatever format we can do it. We started with Zoom calls in March. We would have cocktails on Sunday night with our friends. That gets tiresome after a while. But then when the weather was warmer, we went out to the park. And again, we formed a big circle with a lot of distance between everybody. And it was just felt normal. And that was so key. And now that the weather's getting colder again, we're concerned on how we can maintain real connections with people. Zoom is helpful, but it's just not everything.
Hyam, do you have any thoughts, sir?
Well, it's definitely been a good experience to have my eyes opened about the dangers of COVID. In other words, prior to the pandemic, I commuted via subway to downtown Boston and worked in the office. And I continued that after the news of the pandemic became, everywhere in mid-March. And Tom and he encouraged some of my friends to urge me to start driving rather than taking public transit. And I still work downtown in like an 8,000 square foot office, and I'm often alone, or there's one or two other people. So I changed my routine a bit, in response to the concern that people showed me about, what, exposure I could potentially face. I also thought it was great that Tom initiated both of us getting tested around Memorial Day. We both tested negative, but it was just a good thing to do together.
Yeah. Yeah.
We have had what if we come down with COVID, and what if we're hospitalized?
Yeah.
What are the things that we want to avoid, or what do we want in our treatment? So
you two are obviously experts at being honest and communicating effectively. So you're very good, inspiring role models for the rest of us. Yeah. So
I just wanted to add one thing, if I could, about the power of attorney. You know what? I think sometimes people feel very threatened when they're asked to have a power of attorney or a representation agreement or what have you. And I think what I want to just say is I want to normalize that, because really, regardless of whether we have Parkinson's disease or any other health condition, these are things that we should all have in place, because we never know what tomorrow brings. So we should have a representative who knows what our wishes, our values, our beliefs are. We should have our financial ducks in a row, because we just don't know. All of us should.
So we are going to run 5 minutes over. Elaine, if you could give us a quick, because there's another specific question to you. How does one connect with a chat group? Can you give a quick answer to that?
Like an online caregiver?
You mentioned chats, and how does one connect with a chat group?
So there's a number of them out there. Off the top of my head, I know that the Parkinson's Foundation has a program called PD Conversations, and I know that there is a caregiver line or conversation separate just for caregivers, and also the Family Caregivers Alliance, I believe it's called. If you look at their website, they too have an online conversation that people can engage in. So that's two off the top of my head. Jenna, do you have any other ideas?
Those are the only ones that I'm aware of, but I do know if you reach out to Parkinson's Foundation as well, the helpline is really great, because they can generally, if they don't know the answer, they'll try to look for the answer for you to find chat groups that might be local to you. I guess that's doesn't matter as much now that we can connect with people from all over, but they're very helpful if you reach out to the helpline as well.
So Jenna, while you are online, a couple questions for you on bundling questions, because we have so many of them. One's from Florida and Oregon about advanced Parkinson's disease. You know, sort of, are there treatments for advanced Parkinson's disease? And in conjunction with that is a question from Oregon about a woman whose husband has young onset PD, but he is already fully dependent on her. And they're trying to prepare financially, emotionally, and are asking you that question. Once you have significant cognitive loss, does it mean that the end is near?
So it does not mean the end is near when you have cognitive loss. I think that the main thing to focus on that is quality of life, and thinking about what is then the impact that that cognitive status has on quality of life. You can see sometimes that people may become more dependent at that point. And so thinking as well about the care partner's quality of life, and not being afraid of asking for extra support, and whether that's from family, friends, or maybe having a home health aide in the house as well that could assist further, to how Elaine was saying, to give you some time to spend for yourself as well, and to make sure you're taking care of yourself. With treatments for advanced stage Parkinson's, so when it comes to cognition, you know, with Parkinson's, oftentimes people are prescribed carbidopa, levodopa, and towards the advanced stages of Parkinson's, it can be finding this balance between helping the movement with the carbidopa, levodopa, and other medications that might be prescribed for Parkinson's, and then also that cognitive status as well, because some of those medications can worsen cognition. And so that's really a discussion to have with the provider, with the doctor, because they would know the specific medication regimen. But there are certain medications too that maybe people with Parkinson's when they were younger were prescribed, and as they've gotten older, maybe don't tolerate the medication quite as well. An example would be dopamine agonists like Nupro or pramipexole. Sometimes as someone's on higher doses of that as they get older, it could worsen cognition or induce hallucinations as well. So oftentimes you'll see that those medications start to be tapered off, and a discussion is had to see whether or not those medications coming off, if that improves the hallucinations at all. There are medications that can be prescribed for some of the symptoms of those advanced stage cognitive changes, like behavioral changes or the hallucinations. Something that usually is that we ask here frequently is, are the hallucinations bothering you? Like Elaine said, we have people that will see a cat or a dog, but they really love cats and dogs. And so it makes them happy when they have that hallucination. And so at that point, it's not something that typically medication, at least here, that medication is prescribed for. But if it gets to the point where those hallucinations, they're causing interference with sleep or causing agitation or aggression, then there are medications that can assist with that. It really depends on the individual again, and so it's best to talk with your provider about those if you do feel that the person that you're caring for, the person with Parkinson's, if they're having any of those symptoms or agitation, then to bring that up with the doctor to discuss what options would be.
So there are 3 questions that I'm going to answer very quickly, and then we're going to pivot and talk about the closing points. People ask about exercise in terms of cognition. I'm just going to say that exercise there's a lot of scientific studies. As an older clinician, I've been around the block many times. All the stuff on exercise shows that there's hippocampal growth, there's brain growth in the context of particular aerobic exercise. So it's highly recommended. They ask about sleep. We know that different stages of sleep are critical for different aspects of memory. And we also know that sleep also affects the biochemistry of the brain. It provides amyloid clearance, so it's very important for memory. And they asked about counseling. Is counseling helpful for cognition? And I think both Tom and Hyam sort of underscored that when they talked about the affiliation with their care team at Beth Israel Deaconess in Boston, and the importance of having a third person in the room in order to talk with them about particular concerns. I'm going to turn now to the key points, and I'd like to ask for the panelists to address their key messages, what are their takeaway points? So Jenna, starting with you.
Sure. So I'll go ahead and read mine here. My main key takeaway point is that care partners are crucial members of the care team in identifying and helping their partner with cognitive changes. So those subtle changes or even the more severe changes that we talked about. Care partners are the ones who are with their loved one day and night and can help advocate the most for their partner. Physicians and the rest of the medical care team are only with you and your partner in person for a short period of time. What you observe and what you report to the doctor is extremely valuable information to share. If a change is noticed, you noticed it for a reason, and it is important to bring this up to your doctor. Thank you.
Thanks, Jenna. Elaine?
And so for me, my key takeaway kind of relates to one of the questions that we had for the person who was trying to distinguish between MCI and Lewy body and dementia, that at the end of the day, when we don't know what the diagnosis is, just look at what is the issue, what is the challenge, what is the problem, and really try to look at your resources, both personal and professional, as to how you might resolve the problem.
And Hyam and Tom?
Well, we have carpe diem, seize the day. You got to enjoy life today, but you also need to be prepared for what's coming. We know it's a progressive illness, and I think that's where open communication between the two of us is helpful in planning ahead.
Thank you. And I want to thank the panelists for their time and their expertise. And I also want to thank our viewers for joining us. You'll receive a follow-up email after this webinar with a survey, and please let us know your thoughts about the panel topic and the learning platform. You'll also have space to give feedback to the panelists and to let us know what you'd like us to cover in the WPC Care Partner 2021 program. And finally, I'd like to thank our sponsors, Supernus and Adamas, for making this program possible. Thank you for joining us today. Please save the date for the next webinar on Wednesday, December 9th at 3 p.m. Eastern Standard Time for a session on wellness and the role of the Parkinson's care partner. So thank you all.
Thank you.
Thank you.
Thank you.